Hi, this is Jessica DeMassa in the Guidewell Insights Lounge. I'm here at Singularity University's Exponential Medicine, and I'm with Amer Haider. He is the CEO of DocTell, which is one of our very own Guidewell Innovation studio companies. So Amer, welcome to the show.
Thank you.
Good to have you here. So tell us what it's like to be part of the Guidewell Innovation Studio. Tell us about your experience so far.
Well, first, it was great because we get invited to Florida in this beautiful Guidewell Innovation Center. And they housed us in what they call the garage. So it was a very high-tech, cool place. And we got to meet a number of great mentors from the local market and also from around the country that were able to give us feedback on what we're doing and teach us some new stuff.
Excellent. So talk a little bit more about what it is that you're doing. What's DocTell?
DocTell, we call ourselves the smartless company.
That's great.
Yeah, we're focused on enabling doctors to create checklists or smart lists for their patients.
Okay.
So patients know what they need to do and when they need to do it.
And so the doctor doesn't have to really be involved. It's basically self-management?
The doctor is involved in the beginning to make sure that they create the smart list the way they practice. That's a critical component. You know, patients wait weeks and spend hours to get, what, 5, 10 minutes with their doctor? So, and doctors are frustrated because they don't have the time to communicate everything they want to their patient.
Okay.
Now with DocTell Smart List, they can codify the entire plan of care and in one text or email, send it to the patient.
Awesome. So you guys are really using these technologies to bring care delivery to the patients in a way that's very convenient for them.
That's right, most
Excellent.
importantly, and the family.
And the family. So talk to me a little bit more about, broadly speaking, how you're seeing technology change the way that providers and patients are engaging.
Well, first, it's creating access. That's the most important thing. Today, again, back to that point, if I'm a patient or family, we have the knowledge on what needs to be done, but it's access. Do I know what I need to do now? When do I need to do it? And is that when my doctor prescribed me? We can spend hours on the phone, make a phone call for a quick question, and wait for the whole day to get a simple answer back.
Right.
Technology will bridge that gap.
Any technology that gets us off of hold is a great technology in my mind. Okay, so tell me a little bit more about your experience working with Guidewell. I know we've heard from a lot of startups that healthcare is so challenging to get into. So talk about some of those challenges and how working with a company that's, a broad healthcare company has made some of this a little bit easier for you.
Yes, so it's a marathon. It's not a sprint for sure. And coming from the technology world,
Sure.
It is a ultra marathon. But the key thing is, every entrepreneur that I've met, and I've met a bunch of them, there's a personal passion and story, and that's why we're here. It's not just about making a new new mousetrap and trying to make it better, but to really improve people's lives. So that's what keeps us going every day. And being supported with companies like Guidewell really helps because they give us access and in some cases even accelerate a pilot or go to market and ultimately customer.
So coming from the tech space and moving into healthcare, what advice would you give to another entrepreneur who's maybe thinking of making the same leap?
Most critical is have a doctor as a co-founder.
Okay.
It is critical because in technology we say a lot of things, this is how it should work, but it actually doesn't work that way. And doctors are the key, who are the care providers that can actually guide the technologist on, here's the problem, give me a solution.
Excellent, that's great. And I know we're hearing a lot too about involving more physicians in the innovation process, so that's wonderful advice. I wanted to ask you too, in closing, you're here at Exponential Medicine. We're hearing a lot about some of the technologies that are on the very bleeding edge. What has you most optimistic about the future of healthcare?
Well, I'll say this. Unfortunately, in the US today, poor outcomes at the extreme is the third leading cause of death in America. We're killing 250,000 people due to preventable medical errors. And we know that patient participation can improve that. So I am most optimistic that technologies and healthcare systems are going to start involving patients so that they know what to do, when to do it. And patients are the biggest stakeholders in this. We should empower them.
Excellent. Well, thank you so much, Amer, for talking with us here today. It's a pleasure to have one of our very own Guidewell Innovation Studio companies here with us in our Insights Lounge here at Singularity University's Exponential Medicine. I'm Jessica DeMassa. Thank you so much.